Which is better to treat your degenerative meniscus tear? Is a surgical procedure called an arthroscopic partial meniscectomy better, or is treating the meniscus tear non-operatively with physical therapy better? There is a lot of debate on which is the better treatment, and depending on who you see, an orthopedic surgeon or a non-operative sports medicine doctor, you will get two completely different recommendations. And that's why I'm going to use the latest clinical trial data to make an argument for why you'll want to choose exercise therapy instead of surgery. Hey everyone, Dr. Jeff Peng here. My goal is to help each and every one of you live an active and healthy lifestyle. So if that's something you're interested in, please consider subscribing to my channel. The controversy over how to manage symptoms related to degenerative meniscus tears continues. Many surgeons continue to advocate for an arthroscopic partial meniscectomy. This is a surgery where they go into the knee to cut out the tear and clean things up. But to understand why this may not be a good idea, we need to first understand what the meniscus are. The meniscus are cushions. They play a crucial role in absorbing shock and distributing load throughout the knee joint. When the meniscus gets torn or damaged, it was theorized that this resulted in mechanical symptoms, things like locking or clicking, as well as persistent pain. So if we think the meniscus is the problem, then why not just cut it out? Well, that's what many orthopedic surgeons do, and that's supported by the American Academy of Orthopedic Surgeons. Their 2021 guidelines state that arthroscopic partial meniscectomy could be used for the treatment of meniscal tears in patients with concomitant, mild to moderate osteoarthritis who have failed physical therapy or other non-surgical treatments. But let's take a closer look. Arthroscopic partial meniscectomies are a high-volume procedure with over 500,000 surgeries performed annually in the United States. It is the third most common elective orthopedic procedure in the US after a total knee replacement and a total hip replacement. So if it's something that keeps their surgeons in business, it makes sense that the American Academy of Orthopedic Surgeons have a guideline that says these surgeries may be necessary. But what do data from clinical trials show? Do randomized controlled trials support the practice of arthroscopic partial meniscectomy? Well, over the last few years, there have been multiple randomized controlled trials comparing arthroscopic partial meniscectomy to non-operative treatment as well as to sham surgery. These include the meniscal tear in osteoarthritis research called the METEOR trial, as well as the Finnish degenerative meniscal lesion study called the FIDELITY trial. Both of these randomized controlled trials showed that arthroscopic partial meniscectomy was not superior to non-operative treatment or a sham surgery. In fact, the FIDELITY trial showed that arthroscopic partial meniscectomy resulted in an increased risk for developing worse arthritis in the future, and this finding makes sense. Remember, your meniscus are shock absorbers in your knee. They serve as cushions. Damaged or not, as long as they are still in your knee, they are helping to absorb and distribute the loads. The minute you cut them out, now you have nothing between the cartilage of your bones, and that's going to lead to more wear and tear, and that's going to lead to more arthritis. More recently, another study called the ESCAPE trial published their 5-year results. This is a randomized controlled trial which compared physical therapy to arthroscopic partial meniscectomy in people with degenerative meniscus tears. They found that after 5 years, exercise-based physical therapy remained non-inferior to arthroscopic partial meniscectomy for patient-reported knee function. They concluded that physical therapy should be the preferred treatment over surgery. So now we have 5-year outcome data from multiple randomized controlled trials that all say the same thing. Cutting out the meniscus is not superior to non-surgical management, but cutting out the meniscus does have a major drawback in that it may lead to worse arthritis in the future. And when we look at why exercise therapy works so well, it's because the focus is on strengthening all the muscles in the lower extremity. This new study is a great example on why muscle strength is so important. They wanted to understand the associations between quadriceps strength and knee joint structural abnormalities in a degenerative knee. They measured baseline quadriceps strength and then at 1 year follow-up and examined the patients for structural problems such as cartilage damage, bone marrow lesions, effusions, and synovitis. They found that higher quadriceps strength was associated with less cartilage damage, less bone marrow lesions, less effusions, and less synovitis. This means there is less overall wear and tear, as well as less inflammation and less damage. The authors conclude that stronger quadriceps likely have a protective role on the structures of the knee joint. This is the basis for why exercise therapy and physical therapy is so important for anyone who has degenerative meniscus tears as well as knee osteoarthritis. And this next video is an example of an exercise routine that will help you focus on strengthening the muscles in the leg. Check it out next, and thanks for watching.